So with the iHeart unit on a finger, there's a light sensor inside that picks up the pulse wave. Every time your heart beats, there's a pulse wave that strips down the arteries of the body, down through the arms to the finger. And the iHeart device is able to pick that up so that you see the curve, the heart beating every single time. The funny thing is that when your heart beats, that wave goes down the big blood vessel that goes from the heart through the chest and the abdomen, called the aorta. As it gets down into the abdomen, as the aorta splits into arteries that feed the kidneys and the intestines, and then divides to feed each leg, there are these little reflections that go back up towards the heart. The reflections sum together to form a reflected wave. In a young person, that reflected wave gets back to the heart just as the heart goes from contraction to relaxation. The wave maintains pressure in the aorta, allowing blood to flow into the heart muscle, feeding the heart muscle. It's this beautiful and subtle timing relationship that allows the heart, when it's relaxed and not pumping, to receive blood flow and feed off of the oxygen and other nutrients. That reflected wave continues on to the fingertip. iHeart is the world's highest sampling rate, highest resolution pulse oximeter. It samples 200 times a second. It has 1 in a million bit resolution. We can find and characterize that reflected wave from the aorta so precisely that we can derive aortic pulse wave velocity, how quickly that pulse wave goes down and comes back up the aorta, which is how scientists measure aortic stiffness. Devices to measure aortic stiffness have previously required a pressure sensor over the artery in the neck, the carotid, a pressure sensor over the artery in the groin called the femoral artery, and a skilled technician to run machines that cost $25,000 US. Very expensive and very complicated. With iHeart, we are measuring aortic pulse wave velocity in a way that's affordable and gives you the information each individual needs to understand how things are going inside. The iHeart device has been compared to the gold standard aortic pulse wave velocity measurement system called the SphygmoCor and found to correlate very well. So what we're really trying to do is to make this beautiful and integrative health metric accessible to everyone in a simple and easy fashion.